This video is going to be on leukogram patterns, and it's essentially a review of the previous white cell lectures, but pulling in those different individual white cell changes into one pattern. So I'll start first with the stress leukogram. What we look for to identify stress most consistently is lymphopenia. And oftentimes there's a mild neutrophilia without a left shift. So when we see a neutrophilia without a left shift, we call that a mature neutrophilia. And sometimes, but not all the times, there can also be a monocytosis and an eosinopenia. So for a stress leukogram, we're looking at up, down, up, down. Now, a stress leukogram can also be a component of other leukogram types, especially with acute inflammation and overwhelming inflammation. So with an acute inflammatory leukogram, you can also get a lymphopenia, a monocytosis, and an eosinopenia. And with an overwhelming inflammatory leukogram, you can also get a lymphopenia, monocytosis, and eosinopenia. An acute inflammatory leukogram is also further characterized by a mild to marked neutrophilia with a left shift. An overwhelming inflammatory leukogram, that's when we see a degenerative left shift. So a left shift where the number of immature neutrophils outnumber the segs. Or there's a neutropenia with a left shift. So in either of those instances where there's a degenerative left shift, the interpretation for that is overwhelming inflammation. So segs may be decreased, normal, or increased, and you will have a left shift with bands. Now, as the inflammation persists, that gives the bone marrow and the secondary lymphoid tissues to undergo hyperplasia. So essentially, all cell types are increased due to hyperplasia. But the most consistent increase is the mature neutrophilia, or an increased number of segmented neutrophils. So depending on the type of inflammation, you might see increases in the various other cell types, but the neutrophilia is really what we're looking at to identify chronic inflammation. Leukemoid inflammation is a special type of inflammation where we really don't care what the lymphocytes, monocytes, or eosinophils are doing. We're just looking at what the neutrophils are doing. And in this case, there's a marked neutrophilia that is greater than 50,000 neutrophils per microliter. And with this neutrophilia, we start to think about specific disease processes, and in particular those that start with P. So pancreatitis, pyelonephritis, pyometra, pneumonia, the sneaky P, and then various other diseases that don't start with P, so carcinomas with necrotic centers, or a paraneoplastic response. The last leukogram pattern is the physiologic or excitement leukogram, and that causes a mature neutrophilia, so increased segs without an increase in bands, and a lymphocytosis. And both of those changes are due to washing of those neutrophils and lymphocytes from the marginal pool into the circulating pool.